Well, hello everyone. I'm Dr. David Ajibade with the Brain and Body Foundation, and welcome to Your Health in Your Hands. Now, as you may have guessed, we're not in the NTA studio. We're both in the US. I'm actually in Dallas, Texas. Dr. Mensah, our guest, whom I will introduce shortly, is in Chicago. And we are going to be talking about mental health from a very basic perspective. And I'll tell you what that means in a little bit. Without much ado, Dr. Mensah, I want to say just a few things about Dr. Albert Mensah. He has been a mentor of mine for the last about 2 years now. I think I met him this was 2016. It was 2016 or 2017. We met in Chicago. He came to the hotel then. That was when the Dr. Walsh, there was a research institute seminar going on, and I flew from Nigeria for that. And I was amazed at the depth of knowledge. I mean, I was learning things I had never heard before as a medical student, nor as a doctor. We actually began to hear that there were things that could be done for brain disorders, and not just for brain disorders, but in terms of improving mental health, that we thought were impossible. And we'll talk about that in a few minutes. But Dr. Mensah is the founder and co-founder and director of the Mensah Medical Clinic based in Chicago. And they are doing a lot of pioneering work, especially in the field of brain disorders. But Dr. Mensah, tell us a little bit about yourself, how great you are, some of the things that you do. I warned you there'll be surprises, huh? You're welcome. You're welcome to the show, sir.
Thank you, Dr. David. I appreciate the glorious introduction. I can't say it's deserved. What we are really individuals who stand on the shoulders of giants. The work that we do is not our own initiated work. It is an ongoing process that began with the great Dr. Carl Pfeiffer, MD, PhD. He was a psychiatrist who began work in what we would call now molecular medicine for mental health. The field is actually called orthomolecular medicine. And Dr. William Walsh, my direct mentor, worked with Dr. Pfeiffer in many of these pioneering capacities and has really just exploded this field. And when we worked originally, it was primarily with mental health considerations: anxiety, depression, schizophrenia, bipolar disorder, ADHD, autism. All these things we found were actually correctable. People can lead normal lives. As Dr. David said, we never believed this to be possible in our traditional training for mental health in medicine. And what even I did not believe when I first entered this field, I didn't believe that was possible until I was educated otherwise. So Dr. David, thank you for the introduction. However, this work is not mine. The ongoing process is what we push. The initiated work comes from those who came before us. But now what we've done at Mensah Medical is to take it yet another step further, looking at the crossover benefits between nutrient therapy or molecular medicine for mental health as it pertains to physical health issues. So now we understand that many gynecological problems, from ovarian cysts to fibroid tumors, endometriosis, breast cancer, all have a link to molecular medicine. And we now work with those. Breast cancer, for example. Now we understand these mechanisms can be treated with molecular medicine. Every day, unfortunately, I hear about someone who had a hysterectomy, who can't have children anymore because of dysfunctional uterine bleeding. And now, thanks to the work of the great Dr. Judith Bowman, along with Dr. William Walsh, now we understand that these things are factors that are actually treatable, and many women don't have to go through the process of hysterectomies to correct bleeding issues. It's a molecular challenge that can be treated. In addition to that, everything from, as I said, schizophrenia to autism to now physiological mechanisms, all can be found within the realm of molecular medicine. This is how we do the process of correcting imbalances and actually trying to fix or at least temporize the root cause, as opposed to simply putting a Band-Aid on it with pharmaceutical medications. Now,
Mhm.
please understand me, Dr. David, it doesn't mean that we can't or shouldn't use pharmaceutical medications ever.
Absolutely.
There are times where you have to use both
Yeah.
for a short period at least. But the key is to at least find the underlying causes and to treat them. So that's really what we do. Primarily mental health with a good, strong crossover now to physiologic mechanisms in what we would call traditional medicine. Okay. Whether it's your eye, whether it's your heart, whether it's your liver, there are natural mechanisms involved, and working with those mechanisms can definitely lead to vast improvement, including growth and height. I'll give you one example. You can never grow to your full height potential if you're low in zinc. So using the proper dosage of zinc, not just what you get by the recommended daily allowance in traditional medicine, the proper dosage of zinc allow individuals to actually reach their peak potential in terms of physical height. That's just one small example of what this wonderful world of orthomolecular medicine has now to offer.
Yeah, that's fantastic, Doc. And based on this last point, I can certainly relate to zinc. Probably I was low in zinc too, but I guess it's too late for me now at my age. But it's a big issue, of course. You know, we deal with sickle cell disease. It's a big thing in our practice. And yes, zinc has been shown to be a key factor in their development. Many children with sickle cell, many individuals with sickle cell disease tend to be small for their stature and short. But not only that, but in terms of wound healing and in terms of crises, we see zinc being implicated as a deficiency over and over and over again. So, and interesting. And then of course, we've talked about zinc as a mental health issue, especially when it comes to, I know there are several applications, but what shocked me when I heard this was that 95%, I believe, of all postpartum depression, when the woman delivers a child and she goes into depression, correct me if I'm wrong, a lot of that is due to a deficiency in zinc. Is that correct?
Well, actually, it's more due to zinc's arch enemy. It's due to an excess in copper.
Ah,
There it
okay.
is high levels of copper that is present in the system
I
because
see.
copper to dopamine turning into norepinephrine or adrenaline, which is produced in the adrenal gland, which leads to burnout in the adrenals, which now leads to depression and anxiety. So
I
it's
see.
actually a copper a toxicity of a given metal or nutrient in the system. But the counterbalancing mechanism is zinc. So oftentimes what you see is that anyone who is high in copper is oftentimes low in zinc. So there we have to do two things. We bring down the copper and elevate the zinc. And people do wonderfully well, wonderfully well.
Interesting. Interesting. Well, Doc, there's so much we have to talk about. And again, I'm always aware that we're talking primarily to a Nigerian audience. So we're going to take a step back and we're going to really kind of like address this from a more basic perspective, how nutrition and nutrients or the lack of affect our mental health. Because let's face it, especially with this whole thing with COVID-19 now, mental health conditions have really come to the front. In fact, not just here, not just in Nigeria, but around the world, we're seeing a lot of dysregulation when it comes to mental health. People going, for lack of a better word now, berserk. We're seeing domestic abuse on the rise. We're seeing suicide on the rise. We are seeing astronomical numbers when it comes to just mood disorders. And again, that's related to COVID-19, but I think also it's unveils or it's showing an underlying problem that has been there all along. We have simply not been able to address or promote mental health like it should be promoted. So I want us to take a step back and really let's look at what's the role nutrition and nutrients have to play in mental health. And before we get into that, we're going to take a short break and we'll be right back. Thanks. All right, welcome back. I'm here with Dr. Mensah of the Mensah Medical Institute. And we are talking about mental health from a more, we're going to be talking about mental health from different perspectives, but in this segment, we're going to be talking about it from a basic perspective. And Doc, I got to say real quick that this is really fascinating. That's you're, as a medical doctor, you're freely talking about using nutrients to treat, I use that word a couple of times, treat certain underlying conditions. Can you quickly speak to that before we go into the main nutrient aspect?
Absolutely. So, listen, those of you out there who are fortunate enough to have a vehicle, okay, not everyone in the world has a vehicle. You're not going to take your car to the shop and then have someone put tape around your car and say, hey, go and drive it. But that's what we've been doing in mental health for years, for decades. We've been taking functional tape, we call them pharmaceuticals, we call them drugs, to mask the symptoms of anxiety, depression, bipolar disorder, ADHD, to mask all these things. We haven't corrected anything. So what do you tell the guy at the car dealership? You tell them, no, get me the right parts to fix my car. You are far more precious than any car and far more complicated than any car. The key is to find out what parts you need and then to find the right technician to put those parts into place. That's what we do. So we found the parts that are the problems within the human system when it comes to mental health. And then we can now correct them with the right parts. These parts flow with the system because they're part of the system naturally anyway. What we do is we simply tweak the dosages a bit. We augment the dosages. We produce the right dosage for your body weight, for the severity of the disorder, whether it's mild, moderate, or severe. We can now see that with chemical testing. So like any good evaluation, we first test to see what the problem is. Then we create the right elements to put into play to let your body then take over. So Dr. David, we don't even have to be that smart, okay? What we have to do is to give the system exactly what it needs, and it's beautiful. The system then takes over and does the job itself of re-regulation. We just give it a hint, we give it help, we give it a nudge, we create the right environment, and it does the rest.
So the system is the smart one.
The system is far smarter than we will ever be.
It's interesting. So let's talk about nutrients now and the brain. How has your knowledge evolved? Because again, we're talking to Nigerians now, and some may be lucky enough to access to. I know a few who can access you way off in Chicago there, but from my experience, most Nigerians simply do not want to go visit a psychiatrist. I mean, we see it as a huge, as a stigma, really, to be seen consulting with a mental health expert, be it a psychologist or psychiatrist. And yet they suffer with their mental health conditions year in, year out. And sometimes they pass it down to their kids. We wouldn't be serving them well if we didn't teach people how to take, at a more basic level, how to take control of their mental health. So let's talk about that from that perspective. What are the basic things that people need to understand and know?
I think the most basic consideration is that what people have traditionally called mental health is erroneous. It is not correct. You say, but wait, my mind is affected. No, I tell you something different. Your brain is affected. Your brain is an organ which is greater than the sum of its parts. But that organ is necessary to help produce proper mental functioning. If the organ is dysregulated, if it is not functioning properly, there's no way your mental health is going to be of any appropriate consideration. The same way with your gut. If the micromolecular elements in your gastrointestinal system are not working properly, you can become fatigued. You can become depressed. How many of you go and eat a high density, high fat food meal, and then you don't get sleepy? Isn't that your mind telling your body to take a rest? This is not a mental health issue for most people. It is actually medicine. The problem is that our doctors have not been trained that way. So we don't think about mental health in terms of actual medicine. We think of it in terms of psychiatry because it involves the brain. Wrong.
Hmm.
It is because it involves the brain that this is actually medicine, not psychiatry. All these books have to be rewritten. Now, look, I can say this very easily, and people say, well, how do you know? Very simple. If you have an idea and you test for it and you treat it and it resolves, if the problem goes away, not just once, not just twice, not even 100,000 times, but millions of times, I think you can say that you have a truth involved.
Absolutely.
Not someone's theory, but fact. This is what we have. We have 3 generations of institutions and millions of people who have now been treated this way. And the symptoms of anxiety, depression, bipolar, schizophrenia make them just gone. By using gone. I have personally seen schizophrenics go back to work, get married, have families. I've seen them go back to their education. I've seen them even begin teaching. And they don't have the diagnosis of schizophrenia anymore. The same with autism. The same with bipolar disorder. One of my favorite patients is a young man from a state that you're very well familiar with, Dr. David. And he had bipolar disorder. He could hardly talk to people. 1 year later, he was running his parents' business and convinced them to open up a second business in another part of the state. And he ran both of them. This is a young man who was so stress intolerant, he couldn't even talk to an employee. Now he's running the businesses. This is not theory. These are facts. These facts are truth. And the truth is, much of what we've called mental health is actually medicine. So now when we address the stigma of mental health in Nigeria, I can tell you it's the same in Ghana. I can tell you it's the same in many African countries, okay? Many of you don't know, I'm from Ghana, West Africa. That's where I was born. So I know a little bit about Nigeria, okay? And I can tell you that one of the difficulties that we have is in truly assessing what is going on. Now, I can tell you also that I don't know about Nigeria, but in Ghana, we have all sorts of individuals who are health practitioners, including going back to ancient traditions of fetish priests who accomplish very interesting things. However, they would not be agreed or approved upon by traditional medicine. What I did come to learn from that is that there are many paradigms not initially embraced by Western medicine that are foolproof in native cultures. This is a bridge between the two. This approach talks about using natural mechanisms, testing, and then the rebalancing of those natural mechanisms to produce health and normalcy. Okay, so you take the natural things that your body is made of, the right parts that are inside your body, correct those parts, and wellness comes. It's not mental health, it's physical health. Even with autism, there's big emphasis on gut regulation, helping the GI tract to do what 31 feet of colon or 27 feet of colon in children needs to happen on a normal level in order to improve cognitive functioning. And many gut practitioners all over the world will tell you healing autism, quite a bit of it from many kids, relies on fixing the gut.
Absolutely.
Well, not the brain. So how can this be? It's all molecular medicine, is my point. All molecular medicine, not psychiatry. Okay. So if we're going to do medicine, then we have to do the same things that you do in traditional medicine. 1, identify. 2, test. 3, treat. And then watch the systems correct themselves. Okay.
Interesting.
And, Dr. David,
we're going to need to take a quick break here at this point, Doc. I don't want to lose our thoughts, so please hold on to it, folks. We'll be right back in a few minutes. Okay, stay tuned. Bye. All right, welcome back. We are talking about the basic things, Doc, that affect brain health: the good, the bad, and the ugly. And I'm not going to take any time. I want you to go straight into it and educate our people around the country.
Let's talk about malnutrition. Now, people say, well, I'm not malnourished. Look at me. I'm wonderful. I'm thick. I'm plump. I'm beautiful. This is what we hold as truly rich in our cultures, both in Ghana and Nigeria. Okay. Here's the problem, though. while what we see may look healthy from our perspectives, what we don't understand is that most of the time, the typical Ghanaian and the typical Nigerian diet is rich in starch and tubers, lovely with protein and some vegetables present. But the vast majority of what we eat is actually very detrimental to our bodies and our brains, and their health. All of the tubers, the starches, look, fufu is there, we both know it, okay?
Yes, yes, and don't forget pounded yam.
Absolutely.
I don't know if you guys have, yeah.
And these things are not nutrient dense. So again, what are you doing? You're giving fuel to your vehicle, your body, but you're not giving the proper fuel. It is struggling to work with what it is you've given it, and ultimately it leads to things like diabetes, high blood pressure, okay, insulin resistance, and in a larger global sense, an inability to actually function very long, very well. That can lead to depression, that can lead to anxiety, that can lead to poor focus, it can lead to poor understanding, it can lead to bipolar symptoms, it can lead to all types of things because the system is not getting what it needs. So what are we talking about? Elements like zinc, elements like vitamin B6, elements like proper folic acid for the right people. But most people actually need not folic acid, but elements like methionine. These are the very nutrient elements that are key in any system to help it work well. So I'm going to give you an example. Any nerve requires communication to another nerve by way of what we call neurotransmitters. Those neurotransmitters have to be made. They don't just show up automatically. They have to be made, and they're made because of zinc and vitamin B6 being key in causing enzymes to function. Without the right levels of zinc and B6, you have poor neurotransmitter capacity, poor serotonin, poor dopamine, poor calming neurotransmitters like GABA. So if you're sitting stressed over nothing, your husband comes home, your wife comes home, and you react for no reason and you blow up, you may have something called pyro disorder, which actually means a deficiency in zinc and B6 so that you don't make your calming neurotransmitters. This can happen in your children as well, ages 2 to 4, the teenage years, impulsivity, agitation. Most of the time, these are nutrient imbalances. So when we look at the system, when we talk about mental health, it's really more what is actually happening in the physical health realm. Even with diet, we're not eating properly. First of all,
Doc, are you saying,
yes,
sorry to jump in, but are you saying that the foods we eat don't contain all those things like methionine, zinc, and magnesium and all? We don't have those?
that is correct. Not in the proper concentrations. We spend so much time enjoying our food, and believe me, we enjoy our food.
Oh, yeah.
But we don't ask the question, how truly dense is this? Now I'm going to share with you something very, very different. Let's go to the opposite side of the continent for a moment. Let's go to a starving nation. Let's talk about people who may be in Ethiopia or Kenya. And I'm not saying everyone is starving in these countries, but let's look at the populations that are truly starving, okay? And I shared this with Dr. David. These people would not be malnourished if they didn't even eat a single thing, but they actually drank fortified beverages, like Ensure. In this country, Ensure, what is called Slim Fast, which many people use as a dietary nutrient substitute. But the fact is, it's nutrient dense. And if you give individuals these liquids, believe it or not, they contain the actual dosage and nutrient capacity to allow their brains to function. And not only will they survive, they will actually thrive.
We're talking about a multivitamin here?
Pardon?
Are we talking about a multivitamin here?
We're talking about a liquid paradigm of dense nutrition.
Okay.
I would call it a drink that is fortified. Okay.
Okay. And
now,
how is that different? Because I'm sure they will be wondering, how is that different from a multivitamin? What are the things that it has?
The amount, because of the size of the bottle, the amount of any given nutrient is much higher than what's in a multivitamin.
Okay.
See, a multivitamin tries to put everything that they can think of into a small capsule. This means you nothing, very little of the key elements that are supposed to be in your nutritional bank, which is your body. When you drink these other elements that are out there, these products, they're there to try to help satiate you dietarily, okay? And they usually have much greater nutrient density. I'm not saying this is what we should do. What I'm sharing with you is that you can drink a container of something that has far greater nutrient density than you can eating 3 meals in any Ghanaian or Nigerian day, okay?
Mm.
And the key here is that while there will be caloric density, there'll be lots of calories in the meals that we eat. Those calories are poor in nutrients. The other side, for survival purposes, you may have something that is not high in calories, but it's very, very dense in nutrients. In other words, it's like going to a factory and seeing all the parts you need to fix your machinery, okay? And they're sitting right there. That's what your body needs. What we have to do is learn to blend these things. We have to eat foods that are far richer and more dense in the very nutrient elements that we need. Foods that contain zinc, foods that contain vitamin B6, foods that contain methionine. And what are these foods, by the way? So we have, look, we're sitting there near the ocean, okay? Fish, chicken, eggs, turkey, beef. These are rich in B vitamins and rich in zinc, and in some cases, rich in other elements as well, okay? But we can't now turn and say, well, look, 3/4 of what I'm going to eat is fufu or banku or kenke or yam, and then add some stew, and then with some greens, and then have some meat. This is not nutrient density. This is wonderful caloric satiation. It puts a smile on it. We can tell you 50 different ways to cook plantain. Okay, we can bake it, we can broil it, we can fry it, we can pick it up on the street when someone is selling it. It is wonderfully tasty, but it is a starch. It does not give us any true nutrition. Okay, so
especially nutrition for the brain, especially the nutrients that the brain needs, correct?
Absolutely, absolutely. Yeah. So we can be full, we can be thick, and we can be malnourished all at the same time.
Mm.
Dr. David, you know kwashiorkor, you know marasmus.
Yes.
These things where children are starving and they have the big bellies and they're not doing well, okay?
Yeah.
The problem is nutrient density. It's not just food. Giving them food doesn't work. Their brains are still, your brains depend on the right nutrient balance in order to have capacity to function.
Mm-hmm.
So Africans, we're very prideful on our intellectual capacity, being the best students, being the best this, the best that, so forth and so forth. But imagine how much more appropriate and capable we would be if we had nutrient density in our system, in our approach to food. We would
especially,
also see, yes,
especially from an early age, right? Especially when the brain is developing. Yeah,
absolutely, absolutely. And we know our system is very shy in zinc, very shy in zinc.
Absolutely,
that happens globally.
Yeah, it does. It does. Doc, folks, it's amazing how time flies. But we've talked about just a little part of what it takes. So, Doc, I'm going to have to implore you to see if we can come back again and talk about this some more. Because, yes, we've talked about a few of the things that deal with the neurotransmitters, but we also want to talk about inflammation. We want to talk about things that are toxic, things that many of us are doing. You mentioned plantain now. We know that fried plantain and fried foods can be toxic to brain development. We want to know exactly why that is so and how that affects it. And there are so many other practices that we Africans indulge in without knowing how it affects us as we grow older, especially as we grow older. I mean, before your 30s, you can handle anything, but as you grow older, that alcohol thing and I mean, there's so many things we want to talk about, especially when it comes to brain health, especially in a third world country. So, Doc, we're going to find you and bring you back on the show. But first of all, thank you so much for taking the time to do this. I'm sure people are going to. I'm sure people are going to want to find ways to reach out to you. let's tell, first of all, your website and any other way we can reach out to you if people need to.
Absolutely. Our website is www.mensahmedical.com. MENSAH, mensahmedical.com. And that's probably the best way to reach us. Our telephone number in Chicagoland is area code 630-256-8308. That's 630-256-8308. And, just a quick, as they say, shout out to our young people. Okay, from one African to the rest of the young male Africans out there, you stay away from drugs. Okay, those things are highly destructive, and they lower the level of pride that comes from the African continent. We don't want to bring ourselves to the level of other people. Okay, don't let them fool you. The truth of the matter is that everything from marijuana to cocaine to heroin to PCP, everything that was not endemic to our continent should not be embraced or even tried. If you want to lower yourself, if you want to decrease your capacity to excel, you do those things. I can tell you I've seen more people become schizophrenic from the use of these things, young males, and lose their capacity for life. You want to thrive and excel and make your family proud. Keep up your good work. Stay true to you.
Well said, Doc. Well said. And folks, you heard all that, so stay tuned. We will be bringing Dr. Mensah back. Thank you for joining us, and join us again next week for some more information and more healthy information on your health in your hands. God bless. See you soon. Thank you again, Doc.
Thank you, Dr. David.